Good evening, and thank you for attending our PA Health Talk on weight loss surgery. At the end of the presentation and patient story, we will have a Q&A. Please click on the question mark at the top of the screen to ask a question. You can ask anonymously or include your name. We will also share a link to the contact form you may use to request an appointment should you choose to take the next step. And now I will turn it over to Dr. Falvo.
Good evening, everybody. My name's Dr. Alex Falvo, and I'm one of the bariatric and minimally invasive surgeons at Geisinger in the Northeast Territory. And tonight we're going to be talking about the metabolic and bariatric surgery program that we have in Danville and in Geisinger, Northeast. Next slide. So we have a few objectives for this evening. I want to really get any questions answered at the end, but I want you to understand the process of having bariatric surgery within the Geisinger system, what that looks like, and why it may be beneficial for you. So I'm going to start by just talking about bariatric surgery in general and why it may be helpful or beneficial. Then I'll talk about the different types of surgeries that we offer, noting that each surgery, each individual patient may benefit from a different type of surgery. I'll introduce you to the 7 surgeons that we have within the Geisinger system. I'll explain the pre-surgical process, and then I'll describe what after surgery looks like. And as I mentioned, of course, we'll have time for questions at the end. Next slide. So we know that there are many different diseases that are associated with obesity these days. And here is pictured just a few. The most common things that we see in our practice are things like diabetes, high blood pressure, and other related diseases such as sleep apnea, pulmonary disease like asthma. You may have problems with gynecologic abnormalities, hormonal imbalances, infertility, and we can even see liver disease, fatty liver disease, for instance, gout, trouble with your blood vessels in your legs causing ulcers or other problems. And all of these issues can improve or even resolve completely with weight loss and bariatric surgery. Next slide. Here are just a few of the benefits that we see every day from our patients. These patients have an elimination of insulin resistance. There's remission of type 2 diabetes of 80%, a resolution of hypertension or high blood pressure by 67%. They have improved breathing, improvement or complete resolution of sleep apnea, meaning they don't need their CPAP machines any longer. People can see resolution of their asthma symptoms. Many people have resolution of their reflux disease and heartburn. Many women can have improvement in their polycystic ovarian syndrome and improvement in their fertility. Some patients can have improvement in their congestive heart failure, or their heart function can improve. Some patients have the ability to eliminate fluid from the body when they have maybe lower extremity swelling previously. A lot of people can have improvement in their joint pain or joint problems, improvement in arthritis type problems. And for those who may be looking at joint replacement surgery, bariatric surgery can often be a bridge to help them get safely through that surgery as well. Many of our patients have an improved quality of life, improved mental health. Bariatric surgery can increase your overall life expectancy. Some patients can have improvement in their intracranial pressure, which can lead to fewer headaches. Many patients that have fatty liver disease can see a resolution and improvement in their liver numbers and liver function. And many patients that have hyperlipidemia or high cholesterol can see an improvement in their overall cholesterol numbers. Okay, next slide. This is just a general picture of what the GI tract looks like. Your esophagus connects to the stomach, which then connects to the small intestine. Next slide. So just a bit about the pre-surgical process. Now, here at Geisinger, we have what's called a GI nutrition team, and that's comprised of doctors, physician assistants, dietitians, and nutritionists, and they can help you kind of wade your way through the information about weight loss, whether that's medical weight loss with, diet and exercise changes, medications as necessary, or if you're planning to go to bariatric surgery. You're evaluated by this team, and you see many members of this team throughout the process. You're going to complete many different classes as well, a nutrition class, a surgery class, to gain the information that's going to be vital in your life after bariatric surgery. Typically, this takes about 6 months, which is often the same as most insurance requirements. You also will meet with one of our psychology colleagues who specializes in bariatric medicine and can help to pinpoint any psychological issues that may need to be counseled or medication that may need to be started prior to bariatric surgery. Prior diagnoses, psychological diagnoses, are not a contraindication to surgery. So it's often mistaken that they may be. Once you complete all of these things, we give you what we call the green light. And that means that you get to meet with one of our surgeons to discuss which surgery would be best for you. Next slide. Upon completion of our GI nutrition program, you get that green light. And then a message is sent to our surgical department so that you can meet and set up an appointment with myself or one of my 6 colleagues to discuss surgery. And at that time, you'll be given an appointment date and which specific surgeon you would be seeing. Next slide. So there are a couple things that can hinder this process and things that we try and avoid prior to surgery. So the most important thing is that you must stop smoking, and this is any type of smoking: tobacco, nicotine, non-nicotine, e-cigarette, vape, and even medical marijuana. And this must be discontinued 2 months before completing the process. And the reason for this is that smoking after bariatric surgery can have unfortunate consequences. And it's one of the biggest issues that we can deal with after surgery in terms of ulcers or bleeding. And so we want to avoid that and help. If you need help with quitting, we want to make sure that that is done prior to proceeding to surgery. We do nicotine testing as well, and those do have to come back negative in order to proceed to surgery. We also want you to be actively attempting to lose weight prior to surgery. We want you to try and demonstrate some effective weight loss prior to surgery and be able to maintain that if you're able to throughout the 6-month process. Each individual may have specific medical tests that they need. This can include simple tests such as basic blood work, an EKG, or depending on the individual, may be more involved, such as sleep apnea testing or echocardiogram for heart to look at your heart, or if you had some other specific disease that would need to be make sure that we're completely under control prior to surgery. Next slide. So now we'll talk about some of the different types of bariatric surgery. Pictured here on this first slide is the most common 2 types. We have the sleeve gastrectomy, which you can see there on the left. And in this procedure, about 80% of the stomach is removed and taken out of the body, and you are left with a banana-shaped stomach. And this is now kind of like a tube. And the way that this works for weight loss is by eliminating the excess room in the stomach for digestion. And so the amount of food and drink that you could take in is restricted. The one to the right is called the Roux-en-Y gastric bypass. This is a very common procedure that we perform at Geisinger because we do see a lot of patients that have reflux disease. In the Roux-en-Y gastric bypass, no portion of the GI tract is removed. It's just rearranged. And a small, large egg-shaped stomach pouch is created and then connected to intestine. And so this procedure works by restricting the amount of food that you could take in and also delaying your digestion and absorption. And that is why some of the intestine is bypassed. Next slide. On this slide, you can see two of the a little bit less common procedures that we do perform at Geisinger. We have the single-anastomosis duodenal-ileal bypass, called the SADY for short, and the biliopancreatic diversion with duodenal switch, or BPD. And these two procedures are reserved for patients that have a more elevated BMI or body mass index, usually upwards of 50 and above. And we'll talk a little bit more about BMI a little bit later. And these procedures are a little bit more effective in the terms of the amount of weight loss because they bypass more of the intestine. And so again, these are reserved for our patients that may have a little bit more weight to lose overall. Next slide. So you may be asking, how exactly does bariatric surgery work? Well, it creates a calorie deficit and a micronutrient deficit. And so what that can do is once your body is not getting that same amount of calories, it can start to break down some of the excess weight for energy. And here are just two examples of how that works on the picture here. Next slide. And as I mentioned, our two most common procedures are the gastric sleeve and the gastric bypass. And overall, they're fairly similar in total amount of weight loss, but they can have some differences in terms of acid reflux benefit in patients that have insulin-dependent diabetes, or in patients that are on, for instance, steroids or other immunosuppressant medications. One may be better than the other in those instances. And that's why it's important that each patient has individualized care from their surgeon to determine which procedure is going to be the best for that person. Okay, next slide. So thankfully, bariatric surgery these days is incredibly safe. We have a very, very low mortality rate, less than 1% of all patients. And any mortality that can be related to bariatric surgery is typically related to things like a heart attack, a heart arrhythmia, or a blood clot to the lung. Thankfully, with our extensive medical workup prior to surgery, it is highly unlikely that these things will occur. Other complications that could occur or risks of the surgeries themselves include leakage from the connection points. Because a lot of these surgeries we're using surgical staplers to make connections or staple and remove portions of the stomach, though those staplers are excellent at closing the area, very infrequently we do still have some leakage. Those leakages can cause infection that may need to be treated with another surgery or another procedure. Other potential risks are kind of more general, things that you may see in any surgical procedure. The risk of developing an infection afterwards, the risk of bleeding, and we characterize bleeding by severe enough bleeding that you may require a blood transfusion. Although I will mention that we do what's called bloodless medicine at Geisinger. And so if you had religious beliefs or other beliefs against transfusion, we still do take care of those patients surgically. And of course, the risk of the anesthesia itself. Again, a lot of that risk is mitigated by our extensive medical workup. Some of the long-term risks of having bariatric surgery include developing ulcers or stricture, which is a narrowing of some of the connected points. Now, thankfully, these are also not that common outside of our patients who begin smoking again or taking some of our restricted medications. And that's why, as I mentioned before, quitting smoking is so important prior to surgery. You can also have issues with hernias. As with any surgery, a hernia could develop afterwards. This could be externally on the abdominal wall or even on the inside. Now, we do our best to try and prevent that by closing any defects we encounter during the procedure, but still, our risk there is never completely zero. Similarly, there's always a risk of bowel blockage or obstruction, and this could occur from scar tissue. And then, importantly, there's always a risk of vitamin or mineral deficiencies. And during the process of the GI nutrition program, you would take a nutrition class where you would learn about the important supplements that you would be required to take after surgery. And we do check your blood work for certain vitamin levels about yearly to make sure that you're not falling below. Next slide. So now we'll go a little bit more in depth with each procedure. So as I mentioned, the Roux-en-Y gastric bypass is a very popular procedure that we performed at Geisinger. And that's, again, because we do have a lot of patients that either are on insulin and really benefit from this type of a procedure to try and get off insulin completely and resolve their diabetes, as well as patients that have gastroesophageal reflux disease, things like severe heartburn, which this can also help to treat. So as I mentioned, this procedure is both restrictive because we're creating a small gastric pouch and malabsorptive, meaning that you're no longer absorbing 100% of the calories and nutrients that you take in. All of our procedures are done either laparoscopically or robotically with the small little incisions in camera. Very, very, very rarely would we have to make a larger incision in the event of some emergency to get things done safely. The excess body weight that you would lose in a gastric bypass is anywhere between 60 to 70% of your excess body weight. Typical course is 1 night spent in the hospital. I described some of the complications before, but things like leaks, obstruction, something called dumping syndrome, nutritional problems, ulcers, hernias, and fistulas can occur, but thankfully are rare. This has a great resolution of medical problems, some of the ones that I mentioned from before, but specifically insulin-dependent diabetes and acid reflux. And the vitamin supplements required after this type of a procedure would be a multivitamin that has iron, calcium citrate with vitamin D, and B12 injections. And this can vary from patient to patient. As I mentioned, we do follow along yearly blood work to make sure that your levels are not dropping below where we want them. Next slide. Now, the gastric sleeve, again, you may notice very similar. This is a mostly restrictive, meaning that the way that this procedure works is mostly by removing that majority of the stomach portion, creating that banana-shaped tube that is going to be the stomach. Again, this is laparoscopic or robotic with the small little incisions in camera. You can expect about 50 to 60% excess body weight loss. And this procedure can sometimes be done same day. Most likely, this requires 1 night in the hospital. Similar complications to that of the gastric bypass, including sleeve, B12 deficiency. But one exception is that we do see in some patients that acid reflux can worsen in these patients. And as I mentioned, that's why the gastric bypass is done for patients that have acid reflux problems prior to surgery. This has another very good resolution of medical problems. And similar to the gastric bypass, the supplements include multivitamin with iron, calcium citrate with D, and B12. Next slide. Again, some of our more rarely performed procedures, or I guess I should say more unique procedures. The first one is the SADIE. Now, this procedure combines that shape of the gastric sleeve that you saw earlier with some elements of the bypass. However, this procedure bypasses more of the intestine than the Roux-en-Y gastric bypass. So it's a little bit confusing, but again, these procedures are reserved for our patients that may have more weight to lose. They're also very good in insulin-dependent diabetics, and also can be used in patients that have acid reflux disease. Again, this is typically done laparoscopic or robotic. I would say it would be very rare for it to be done with that open incision or large incision. Excess body weight loss is anywhere between 75 to 80%. Typically, these patients do stay 2 nights in the hospital to ensure their safety. Again, similar complications to the other 2 procedures, but highly effective in resolving medical problems. The vitamin supplementation in this procedure is the same as the first 2, but with the addition of A, D, E, and K, which are our fat-soluble vitamins. Next slide. Lastly is the biliopancreatic diversion with duodenal switch. It's definitely a mouthful. And this procedure we do reserve, as I mentioned, for high BMI patients or body mass index, usually above 60 or even closer to 70 to 90. And this can be done laparoscopic or robotic. Again, it's very rare to do it with an open incision or large incision. Very effective for weight loss, 75 to 80%, 85% of excess body weight loss. 2 nights stay in the hospital with similar complications to the other 3 procedures. A great resolution of medical problems. And as the same as the SADI, the supplementation for this includes your multivitamin with iron, your calcium citrate with D, vitamin B12, and those fat-soluble vitamins A, D, E, and K. Okay, next slide. So now let me introduce our surgeons. First, we have my boss, Dr. Anthony Petrick. Dr. Petrick has been with Geisinger for nearly 25 years. He's our division chief, and he operates out of Danville. He's been doing this quite a long time, and he wears many hats, including being chief quality officer. As you can see, he graduated from Georgetown and did his residency in Georgetown before moving on to some fellowships in Boston and in Pittsburgh. He's a member of many societies and is just an excellent surgeon and my mentor. Next slide. Dr. David Parker, also out of Danville, is the director of our MIS Bariatric Fellowship, and he graduated from West Virginia and did residency with the Army before completing his fellowship in Geisinger. And he also has been with Geisinger for, oh boy, almost 20 years, and he's in Danville. Next slide. Dr. Obradovic, another Danville surgeon. He's the research director for our division. And he also did his residency and his fellowship in Geisinger. He moved to New York for a few years and then moved back to kind of finish his career out here with us in Geisinger at Danville. Next slide. And then another Danville surgeon, we have Dr. Osama Shaheen, who just recently finished his minimally invasive and bariatric surgery in California. And he's joined our practice in the last 12 months and has been exceptionally successful at getting started. Next slide. In the Northeast, we are functioning mostly out of Scranton. We have Dr. Ryan Horsley, who's the MIS and Bariatric Director in the Northeast. He attended West Virginia Osteopathic Medical School. He did his residency in Wilkes-barre at GWV before completing his fellowship at Geisinger as well in Danville. And Dr. Horsley operates at GCMC in Scranton and sees patients in Mount Pleasant and in Tunkhannock. Next slide. Then we have myself. I did my residency in Allegheny General in Pittsburgh before moving on to my fellowship in Geisinger and Danville. And then I've been up in the Northeast for about 5 years. I also operate out of GCMC in Scranton, and I see patients at Mount Pleasant and at GWV. Next slide. We have Dr. Mark Mahan, and he also did his residency and fellowship within the Geisinger system. He's been operating with us up in the Northeast for about 2 years, and he's also been exceptionally successful. He sees patients at Mount Pleasant and also in Mount Pocono. Next slide. All right, so back into kind of the pre-surgical work. So once you've finished the GI nutrition program and you've seen your surgeon and you've gotten your surgical date, 2 weeks prior to surgery, you'll have a communication from our GI nutrition colleagues about medications to start, stop, or hold. And also you'll start your high protein liquid diet. Next slide. On the day of surgery, depending on where you're having surgery in Danville, if you have a CPAP, you bring the mask only. In the Northeast, if you're having surgery in Scranton, we ask you to bring both the mask and the machine with you if you have a CPAP at home. And also what's called an incentive spirometer, which is a little plastic gadget. I always call it lung exercise, which you'll be given prior to surgery. Next slide. So now you've gone through the GI nutrition program, you've made it the full 6 months, you got your green light, you did your 2 weeks of your high protein liquid diet, you had surgery, and now you're home recovering. After surgery, the requirements are mostly focused on hydration first. So hydration is our priority. We want to make sure that you are not getting dehydrated at home and that you're continuing that high protein liquid diet until your first office visit. We also have our patients take Lovenox, which is a blood thinner, and that's to help prevent blood clots after surgery. And depending on each individual patient, you're going to either have that for 10 days or 28 days. Our patients also are taking 3 months of an acid blocking medication while healing, and that just helps with the healing process. A majority of patients can discontinue that after the 90 days. As I had mentioned, no smoking. That is our biggest kind of battle cry. Any inhalation can really set our patients up for problems with ulcers or strictures, as I had mentioned, and we're really trying to avoid those issues after surgery. And we encourage our patients to exercise. Light activity, walking, either inside or outside, is very healthy, and it really helps to get the body moving after surgery. It also helps to prevent things like the blood clots I had mentioned, pneumonia, and it helps to kind of get you back into the swing of real life. An important note for our patients of childbearing age, birth control orally may not be as effective after surgery. And as well, our patients who may have had some infertility prior to surgery can have that start to improve. And so we tend to recommend 18 to 24 months of an implantable birth control method, either an IUD or an implant in the arm, so that you can continue to safely lose weight without becoming pregnant. As you can imagine, if you do become pregnant within that time frame, we have to make very special considerations for the health of both the mother and the fetus. And of course, we ask you if you have a CPAP machine that you continue using it during your weight loss process. It's also very important to help circulate oxygen to those healing areas on the inside. And ultimately, if you do improve your sleep apnea, eventually you could be retested by your sleep medicine doctor and completely discontinued on your CPAP. Next slide. As you can see here, these are a picture of what we call our help card. And every single one of our bariatric patients gets these. On one side, you have our Northeast bariatric surgery help card. On the other side, you have the Danville bariatric surgery. So depending on where you have surgery. And these are just the helpful numbers to call in the event of an emergency. Or if you find yourself at home struggling with hydration, we ask you to call us first. Sometimes there can be things that can be done without having to sit and wait through the emergency department waiting room, and avoid an unnecessary trip to the hospital. And so we always ask you, at least in the first 30 days, please call us if there's any problems. Next slide. After surgery, as I mentioned, focusing on hydration, of course, you will be following up with our GI nutrition program in addition to our surgeons. And at those times, we can make some adjustments for medications that you may have been on, whether that's insulin or other diabetic medications, medications for your blood pressure or your cholesterol. And many of these things can be discontinued. Some of them can be immediately discontinued, while others you may notice a slow discontinuation over time. We also ask that you have your support person with you at home for your first 3 days at home to make that transition out of the hospital a little bit easier. Many of our patients are able to return to work, especially if they are not doing very strenuous labor-intense work, within a few weeks, but anywhere from between 2 and 6 weeks of recovery after this type of surgery. We ask you to avoid things like lifting or bending over initially to help reduce the risk of hernia development. And most of our patients are able to drive between 1 and 2 weeks after surgery, assuming that they're not taking any narcotic pain medications. Next slide. So, what are the essentials for being successful in this process? The first and foremost is motivation. Our motivated patients really are the ones that are following all of the guidelines and rules that we lay out for them, and they are going to be successful not only immediately following surgery, but for a lifetime. I think another thing that makes you very successful is a willingness to change. Many of our patients do have to make notable changes to their eating behaviors even prior to surgery to help set them up for success afterwards. And we know, based on a lot of the research that we've done, that preoperative weight loss can demonstrate that you're going to be very successful after bariatric surgery. Another thing would be a knowledge of nutrition. And like I mentioned previously, you would be attending a nutrition class to learn about the important components of nutrition following your bariatric surgery. And following the guidelines that we give you, again, is just going to help to set you up for success after the procedure. And this includes the supplementation with the vitamins and minerals I mentioned for each individual surgery, and having your levels checked yearly, just to make sure that things are not dropping low. A commitment to exercise and physical activity is important after bariatric surgery, and actually many of our patients are able to start joining in the things that they used to love to do again, and that gives them just great joy after surgery. And then lastly is a supportive environment. It's really important to know that because this is a lifetime change, your loved ones and those that you may live with would really need to support you in this endeavor. Next slide. We have our support groups, which are a part of our program, and you would be attending 2 of those during the 6-month program. And those are usually by phone. We also encourage, if patients would like to continue support groups, even after surgery, they can join. There's also many support groups online, and people have found many outlets to find support for from the greater bariatric community. Next slide. And just a couple things, a lot of new information has come out basically in the last 2 years about weight loss and weight loss medications. And so I just want to kind of set the record straight on a few things. So bariatric surgery is still a very effective treatment for obesity and its medical problems or related medical problems. And it should be offered to patients who are interested and are not being successful with diet, exercise, and lifestyle change alone. As we know, GLP-1 medications have been really kind of popular in kind of culture in the last 2 years. And it's important to note that when you're comparing bariatric surgery to these medications, the fact of the matter is that surgery still results in overall greater long-term weight loss. It still it can reduce the need for lifetime medications, and it's more cost effective. As we all have heard, those GLP-1 medications are exceptionally expensive and need to be continually used in order to be effective. And then the last thing is just to ensure optimal outcomes. Surgery is best when it's performed within a multidisciplinary type of program, such as the one we have at Geisinger. And this program is comprehensive for before, during, and after surgery. And it's the patients that continue to follow in our program even after surgery that are most successful. Next slide. So we have this here. This is just the link and the contact form. If you're interested, you can certainly join or send your information in if you're interested in taking the next step in the GI nutrition program and finding more about the program itself and what surgery may look like for you. And these are just some slides that we've noted that again, specifically when we're talking about our patients that have type 2 diabetes, bariatric surgery is the most effective treatment, more effective than insulin in eliminating and resolving type 2 diabetes. And just have two, there's a second slide, you can go ahead to that one, that just demonstrates the same thing. Next slide.
I believe this is where we're going to share the video. Daryl?
Okay, great. We have a short video about one of our patients.
Having bariatric surgery is life-changing. Second best thing I've ever done. Best thing I ever done was marry my wife, Wendy. Second best thing I've ever done was have this surgery. And it has changed my life. 5 years before the surgery, I got rushed to the hospital with a very high blood pressure. That was 503 pounds. Shortly after that, I went and saw my doctor. My doctor said to me, you need to do something. 50 is a possibility, 55 is a pipe dream. You're not gonna see your 55th birthday if we don't change something. So they went out and sent out the referral. Geisinger accepted me. I fluctuate between about 230 to 240. I'm very happy there. My doctor's very happy with me there. And that's where I think I'm gonna stay for the rest of my life. And honestly, that's a whole lot better than 503. I turned 52 in November, but I feel like I'm 5. I feel like I've gotten a new life because of this surgery. I ran the Syracuse half marathon. When I crossed the finish line at 11 o'clock, it was 87 degrees. It was the hottest day on record in central New York in April. And I just ran my first half marathon. I was crazy. As I crossed the finish line, I went like this. And I just stopped because I'm just so grateful for the opportunity. Dr. Parker, Dr. Still, all the dietitians, everybody at Geisinger that has had a finger on this. That race then it completely bit me. And at that point, I realized this is what I wanted to do. I loved running the race. I loved the camaraderie, but I also loved the solitude of the training runs. Getting up at 4 o'clock in the morning, running country roads by my house, it is giving me such a peace. I run with a shirt that on the back of my shirt, it says, from 503 pounds to 13.1 miles. It just shows where I've gone and what my mindset is. I'm grateful. I'm grateful for the opportunity that I can cross a finish line. I'm grateful that I can get up every morning and not have to worry about running out of breath just because I'm stepping down a step to go out of my house. That I am actually out running
Yeah, Chris is one of Dr. Parker's patients, and I think quite an inspiration to all of us. With that said, if you have any questions, go ahead and put them into the question and answer box. I see one from Jay that says, typically, how long are you off work? And so I would say each individual, it kind of depends on if you're doing any heavy lifting within your work. But I've had patients go back within a week to 2 weeks, especially if they're doing things like work from home or desk work. I would say our usual maximum time off work is six weeks, unless there's extenuating circumstances. But a lot of people are feeling really well by the second week after surgery. The second part of the question is, what about caffeine intake and secondhand smoke? So we do ask you to eliminate caffeine prior to surgery. While caffeine is not as causative as nicotine and smoking in terms of creating ulcers or strictures, it can potentially cause some harm. And so we discontinue or ask you to discontinue caffeine prior to surgery. And typically we ask you to keep off the caffeine for at least 6 weeks to 3 months after. Secondhand smoke is another great question. Yes, we do know that there are probably some potential risks with the surgery and secondhand smoke. The nicotine testing that we do is able typically to detect the difference between inhaled smoke and secondhand smoke. And again, it's kind of all to do with creating that support environment. Knowing that this is a commitment that you may be taking, you may ask those around you to potentially quit with you or quit smoking on their own, or maybe smoke outside, things like that, to try and, prevent any adverse outcomes. Thanks for your question. I have another question from Susan. Will Medicare and Geisinger Gold cover the cost? Yes, I believe both of those insurances do cover this type of procedure. We do try and evaluate each individual's insurance as they come into the GI nutrition program. But since every individual insurance is just slightly different, my best recommendation would be to review your own policy and see what your bariatric benefit entails. And that may be different for every person based on their plan. And typically, if you have any questions, you could call your insurance department and ask them, and they should be able to answer any questions about what kind of coverage you may have individually. Wayne has asked about average cost out of pocket. We do offer a self-pay option, and that last I checked is somewhere around $17,000. And if that would be something that you would be considering, you would meet some of our financial employees, and they could discuss the options of self-pay. And then I have from Vicki, are there any common side effects after surgery, such as nausea and soreness? Great question. So immediately following surgery, the biggest thing is dehydration, and that's why we're really pushing the fluids immediately following surgery. Some of the kind of side effects from surgery can be a lower tolerance to things that have sugar in them, and that can cause something called dumping syndrome. And basically what dumping syndrome is when you have a high sugar, high fat meal after bariatric surgery, you may experience some nausea, some cramping, facial flushing, heart palpitations, and diarrhea. And it's because the body no longer can handle all the excess sugar as well as it did prior to surgery. It's also part of the kind of that lifestyle change that we're, recommending that you kind of eliminate some of the higher sugar, higher fat foods from your diet completely, in order to maintain and sustain the weight loss that you get from bariatric surgery. As far as soreness, everyone's a little bit different about their pain level after surgery, but we have actually gone to a no narcotic pain regimen. So each of our patients gets something called a tap block during surgery. I like to tell my patients that you could think of this like Novocaine that you get at the dentist's office. So it's a temporary pain blocker to try and ease that soreness on the abdominal cavity. There's some mild soreness that you can be expected with laparoscopic surgery, which improves over time. And as I mentioned, it's usually pretty well tolerated. Our patients typically are going home just on extra strength Tylenol after surgery. And that is usually enough. And some of our patients actually say that they don't need any pain medication at all after surgery, which we love to hear. We know, obviously, you know, narcotic pain medication gets a bad rap, but it can cause all sorts of things like nausea, constipation, and of course, dependency. So avoiding that really has been beneficial for our patients. Okay. I have a question about how much weight we need to lose to have the surgery done. So it's really individualized. And when you meet with the nutrition team, they will discuss kind of what your weight loss goals would be during your time in the program. And the kind of overall, you know, general goal is just to show that you're able to make some, you know, if needed, some good behavioral changes and help to try and demonstrate that you're working towards this goal. So there's no set amount, but that would be individualized based on your starting weight, your height, your BMI, which is your body mass index, and other factors such as your level of activity. You know, we have patients that sometimes are restricted to a wheelchair or other, you know, mobility issues. So again, it's a very individualized conversation once starting the program. And then I have Michelle who's asked, what if my insurance covers the surgery but not a revised procedure to correct complications? Yeah, that's a great question. So there are some insurances that have a lifetime bariatric benefit. And what that typically means is that you wouldn't be able to have more than one bariatric procedure electively. What that does not mean is, God forbid, you had a complication such as a perforated ulcer or bleeding or something like that. Those things would still be covered because they're emergencies. What this question I think is getting at maybe is we do have some patients who elect to have, for instance, the gastric sleeve, and then can have, you know, problems with acid reflux after the gastric sleeve. And if you only have a one-time policy, and everyone's individual about that, then you may have difficulty getting a conversion to a gastric bypass covered. So I think it is definitely something that on a national level we're looking at to try and convince insurance companies of the importance of having a little bit more leniency there. But again, it's going to be based very individually on each person's insurance and what they will or will not cover. Okay, I think there's a couple more. My insurance is finally going to start paying for this April 1st. Do I wait until April 1st to make an appointment or referral? So I think it should be such that you could start the GI nutrition prior to when your insurance begins to cover the bariatric surgery so that you can start the process. Because remember that the GI nutrition pre-surgical process is typically about a 6-month process. So I think it would be fine. Your physician, your primary care physician or family doctor can put in a referral to GI nutrition, and that's how you get started. You also can fill out the forms that we have to get more information and be connected with our team. Michelle writes, I'm on meloxicam for fibromyalgia, and I was told I won't be able to help take this after surgery. Will this surgery help fibromyalgia? Yes. So there have been many studies that fibromyalgia can improve after bariatric surgery. With weight loss and bariatric surgery in general, the total body inflammation has been shown to decrease, which does improve things like osteoarthritis and fibromyalgia. Meloxicam is a tricky one because it's not quite as dangerous as things like ibuprofen after surgery, but it still can have that same ulcer-inducing effect, which can be risky after surgery. And then Vicky said, post-surgery, is it recommended to track your daily food intake? So we do have you tracking your volume of fluid and your grams of protein. And again, depending on how far out you are from surgery, it may evolve and how closely you're monitoring those things. Some people need to kind of keep track on a daily basis of what their intake is in order to maintain that good kind of process as they get further and further from surgery. Other people are able to kind of get into their new routine and don't have to be as strict. So, so the answer is yes and no there. Any other questions? These are great questions, by the way. Looks like we have about 7 more minutes, and we do have our slide there. So if you have any, if you are interested, you can visit the website there and fill out the form to receive more information. And I just want to thank you all very much for joining tonight. And I hope that you learned a little bit more about us and what we do and why we do it. For myself personally, there is no better moment than when I see a patient after surgery who, has been able to, go ride bikes with their kid for the first time in, years, or, take that trip that they wanted to take, or just, really improve their overall quality of life. And there's no better moment for me personally, and it's why I chose this field, and I'm so passionate about it. So,
all right, well, thank you so much, Dr. Falvo. This was extremely helpful and interesting, and I hope everybody got the information they need to take the next step, and we look forward to helping you in your weight loss journey.
Thank you for having me.
Absolutely.